Thyroid eye disease happens when the body's own immune system attacks the thyroid gland and the tissues around the eye socket. This is an autoimmune condition. The symptoms of thyroid eye disease involve the tissues around and behind the eye becoming red and swollen. This can cause the eyes to become prominent, or what's called proptosis. It can also cause the eyes to be very painful, to have pain on eye movement, the eyelids to be red and puffy, and even in severe cases cause the vision to be reduced or even lost. Although most people with thyroid eye disease have a history of an overactive or an underactive thyroid gland, this is not always the case. Some people will develop thyroid disease many years later, and a few will never actually develop any thyroid dysfunction. Thyroid eye disease most commonly affects women aged in their 20s and 30s, but it can also affect men and in fact can even affect children. There are two factors that make thyroid eye disease much more severe. These are poor control of the thyroid function and smoking. Smoking can make thyroid eye disease much more severe, and it really is absolutely essential that you try and either stop smoking or at very least cut back, and we'd encourage you to see your GP for help with this. Most cases of thyroid eye disease are relatively mild and either need no treatment at all or just lubricant drops. However, some more severe cases will need more significant treatments. Sometimes we use radiotherapy, which is a similar treatment to that we use for cancers, but in much lower doses for thyroid eye disease. And occasionally we do surgery to reduce the pressure behind the eyes and also to reduce the prominence of the eyes. Inactive thyroid eye disease is when the inflammation has settled down. However, unfortunately, you can still be left with prominent eyes and tightness of the eye muscles and enlargement of the tissue behind the eye. This can cause you still to have dry, uncomfortable eyes. It can also cause you to still have double vision. This may need to be treated with prisms in your glasses or even squint surgery. Sometimes, at this inactive stage, we also do surgery to reduce the prominence of the eyes. Orbital decompression surgery involves removing or thinning down 1, 2 or 3 of the 4 bony walls of the eye socket. Sometimes it also involves removing fatty tissue from behind the eye to help reduce the pressure. The decompression surgery is used in sight-threatening inflammatory thyroid eye disease to take the pressure off the optic nerve and protect the vision, and it's also used in the inactive or quiet stage to help the eyes move backwards and improve the appearance of them. There are several different techniques of orbital decompression surgery, and the precise one used will depend on your own situation and the surgeon doing the surgery. Sometimes a small cut is made at the outside corner of the eye to access the bony walls of the eye socket, and on other occasions we approach the inside of the eye socket, and this is often now done endoscopically or with a camera system up the nose. Sometimes both techniques are used for severe thyroid eye disease. In both cases, the incision or cut is actually very small. However, it is a very successful procedure and has relatively low complication rates given what a big procedure it is.